Hi everyone, hey, Nigel here from Phoenix Rehab. Today I want to share with you and follow up on the series of skiers thumb, gamekeepers thumb. And today we're talking about how to test for skiers thumb and how to test for gamekeepers thumb. And there are three different types of tests I'm going to talk about. It's all manual tests that you can do on your own. Of course, the most accurate, the most sharp and clearest one would be doing diagnostic imaging, which is using MRI, where you can see inside. But if you're at home, you can't go to the clinic, or you suspect that you have, you can try a test for yourself before seeking help. So this is a video for you. So the first test is you test and palpate for how sensitive it is. So I shared earlier, so skier's thumb or gamekeeper's thumb is also known as thumb knuckle ulnar collateral ligament injury. So if you take a look at your thumb, right? So if this is a thumb knuckle, there's ligaments on the outer part and there's ligaments on the inner part. The inner part knuckles are the ones that's closest to your index finger. So for skier's thumb, it refers to the inner ligaments over here. So you put your hands over where the ligaments are, like I show you over here. Then you palpate. Palpate means to press around. Okay. If you feel a bit of a soreness, mild soreness, it's fine. Uh, Everybody can feel some mild soreness, but if you start to feel like sharp pain, that's when you start paying attention. It's like, oh, if sharp pain is either there's some form of a sprain in already, or if it's really sharp, then you're like, oh, okay, that could be a partial tear or a full tear, depending on how bad the injury is, right? Once you feel it around, you feel, and then you're like, okay, there is some sharp pain over there. That's when you should level it up to test it further. The second level test is called a stress test. Using passive motion. So what you do is ideally you can stabilize this bone, this MC metacarpal bone, but because I'm demonstrating to you, I can't stabilize it. What you need to do is that using your thumb, you put your thumb on the joint, on the outer side of the joint itself, and your index finger on the other joint of the thumb. And then what you're going to do is you're going to pull this part away from the hand, away from the index finger. So what you're looking for, you can see the image A over there, image A, the one in blue color. You want to see whether it gives. If it gives and go outwards, you know, like, I mean, the picture is quite obvious. That one, the picture shows that the ligaments have totally busted. It's gone, right? So if you feel a bit sore but it doesn't give, it could be partial torn or it could be just a sprain. So don't push too much. You don't cause a big injury. Okay. So if it doesn't give, it's still there. It's still fairly stable. But if it gives like the image A, image B, that means the ligament is totally torn already for that one. So the third test is called a resistive stress test. So what you want to do is that you want the patient or yourself to bring their thumb closer towards their index finger. So they're trying to bring the thumb this way. What you're trying to do, you're trying to pull the thumb away, and you're doing like a tug of war. You know, you try and resist each other. So this is a resistive test. And what you want to do, you want to elicit the same type of pain that they first had when they injured their thumb for the first time. So if they feel the same pain that they had when the first time they injured their thumb, it's likely that they have skier's thumb or gamekeeper's thumb. So these are the three tests that you can do right now today at your home or your office to confirm whether you have skier's thumb or gamekeeper's thumb or goalkeeper's thumb or not. So if you do have it, or you suspect you have it, you can also start to make your calls to the orthopedic surgeon or the hand surgeon or hand therapist to get treatment and check out what is your options, which I will share with you in another video as well. What's your options when you have a skier's thumb? So keep out for the video and I'll talk to you soon. Take care, guys. See you. Bye.